Well, we're on chapter 25, module 155. We're doing pathology and laboratory. It's a lot of fun. I don't want you guys to be, oh, the word just flew right out of my head. I don't want you to be discouraged through this process. I want you just to pay close attention to the rules and regulations we're going to talk about, and then take it one step at a time. And remember, you need to read your step-by-step manual because it's going to have lots of great information on coding in there. The first thing that we're going to start with this morning is I'm going to share my screen first of all. And I want to tell you a couple of things, and I'm going to bring you on this little journey with me because I need to bring you to documents so that I can show you some important information that I think you need to know. First of all, I want you to know what an assay means. ASSAY. In medical testing is a test done to detect the presence, amount, or potency of a substance found in a sample. In other words, a test to determine something about a substance. In terms of drug testing, a type of assay known as an immunoassay is performed to detect the presence of drugs, metabolites in urine. Okay, so you're going to be seeing this word a lot, assay. So that's why I wanted to make sure that you knew what the definition is. And it's in medical testing is a test done to detect the presence, amount, or potency of a substance found in a sample. Okay, another couple of things that words you're going to need to know is qualitative and quantitative. And I'm not going to read all of this. I'm only going to read a very short amount of it, but I am going to have it uploaded for you so that you can refer to it or print it out. So sometimes billing for drug testing can become pretty confusing, but here are some basics. Drug testing codes in the Pathology and Laboratory chapter of the CPT codebook are defined as either qualitative or quantitative. A qualitative test tells you if a particular substance, analyte, is present in the specimen. Quantitative tells you how much, the quantity of an analyte is present. So qualitative tells you if the substance is there or present. Quantitative tells you how much. Qualitative, is it there? Quantitative, how much is there? So you can see a whole lot of other information here, excuse me, but I'm not going to read that for you. I'm going to let you read that on your own. It will be uploaded underneath this video so that you'll be able to refer to it. Okay, so this is our next little thing. We're going to do pathology and laboratory in our little CPC test taking resource.
CPC exam, pathology and laboratory. In this course, we'll cover the pathology and laboratory section of the CPT manual. We'll provide a breakdown of various subsections of pathology and laboratory and take you through some of its more important sections to help you prepare for the CPC exam.
One of the two smallest sections of CPT Category 1, the Pathology and Laboratory section, contains codes for the numerous medical tests specialists perform to determine the cause of a patient's condition. This may include blood tests, drug tests, urinalysis, hematology, and a variety of other assessments. Despite being a relatively small section compared to, say, surgery, around 10 of the 150 questions on the CPC exam will focus on path and lab. This figure is approximate as the AAPC does not publish the makeup of the CPC exam. Let's look at the pathology and laboratory section now. Pathology and laboratory features a variety of clinical tests. Most of these, like the panels found at the front of the section, include taking samples from the patient and analyzing them. Panels is a set of biological samples, like blood, analyzed in a lab. Here's a more detailed look at the types of tests pathology and laboratory includes and the numerical ranges they occupy. There are two types of general tests in Path and Lab, qualitative and quantitative. Quantitative tests show how much of a certain thing is in the body, say calcium or alcohol, while qualitative tests for the presence of a substance, period. Path and Lab codes are measured by the number of tests performed and not the results of the test. That is, if you tested for phenobarbital and alcohol, you'd list that as 2 procedures. Let's look at the first section of panels. Each panel has a set of requirements. A comprehensive metabolic panel, for instance, has to test for albumin, carbon dioxide, potassium, sodium, total protein, and 9 other substances. What the panel requires determines on the system or pathology the panel is trying to determine. Up next is drug testing. The first portion of this subsection is made up of qualitative assays. They test whether a drug is present. Then there's a drug assays. There's a specific code for each type of drug. These drug assay codes are all quantitative. How much lidocaine in the system, for instance. The Path and Lab section also includes a number of pathological tests. Molecular pathology procedures test genes, antigens, and a number of other biological functions to assess the possibility or confirm the diagnosis of a condition. A test for the genetic predisposition to a certain type of breast cancer, for example, would be found here. Following the molecular pathology is a chemistry subsection. In this subsection, there are tests for specific chemical compounds, which can tell the pathologist or physician about the patient's condition. The immunology section is similar. Tests in this section help determine the presence or response of certain important chemicals in the body as they're related to the immune system. Here you'll find tests for certain allergens and quantitative assays for tumor antigens. Path and Lab also contains a subsection for microbiological tests. These tests determine the presence of organisms like Giardia, rubella, hepatitis, and HIV. There are specific codes for each microbiological organism. The section closes with anatomic pathology, surgical pathology, and a number of other types of pathological investigation. In anatomic pathology, you'll find procedure codes for autopsies. Surgical pathology involves the assessment of human tissue. Anytime tissue is removed for examination, there's a relevant Path and Lab code. If a surgeon is performing a biopsy of the bone marrow, there's a Path and Lab code for it. Ditto for the resection of an adrenal gland or a mastectomy. These surgical pathology codes are divided by level. Each level is rather large and covers a wide range of things. They're grouped by the difficulty and/or expense of the excision or resection procedure. So, the more difficult or costly a tissue sample is to obtain, the higher the level of surgical pathology code you'll use. Surgical pathology also includes codes for Path and Lab tests that are performed during surgery. You'll probably see a question on this on the CPC exam. In this procedure, a pathologist analyzes a tissue sample during the procedure in order to ensure the surgeon has removed the appropriate amount of tissue.
Okay, so I want you guys to keep in mind that you're not taking the CPC exam, you're doing your NCCT. So how many of those questions are going to be on your NCCT? Well, I don't know, but I didn't want you to get caught up on that. I just wanted you to actually listen to the information. So we're going to move straight into our Path and Lab slides. Now get comfortable. There's quite a bit of these. Remember, you need to have out your CPT books so that as I give you these number ranges, you can pull out your CPT books and you can actually follow along there. So Chapter 25, Path and Lab. So the easiest way to find the main term in Path and Lab is the procedure name. For example, a hemogram, an abbreviation or an acronym, ALT, or the microbe product in the blood, cocaine metabolites. So those are the easiest ways to find the main term in Path and Lab. The Path and Laboratory section of the CPT manual is formatted according to types of tests performed. The types of pathology and laboratory are subsections such as organ or disease-orientated panels, drug assays, therapeutic drug assays, and I'm going to just let you guys read through that on your own. I will show you at the end of our slide presentation, I will show you how I have my CPT actually labeled or tabbed. The services in Pathology and Laboratory section include the laboratory tests only. The collection of the specimen is coded separately from the analysis of the test. If a patient had a clinic lab technician withdraw blood by means of venipuncture of the finger and the sample was analyzed in the lab, you would use code 36415 for the venipuncture, in addition to a code to report the test performed on the blood. Laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility. Indicators imply that if a test is found positive, it is assumed that the physician wants more information on the condition. If a routine urinalysis is performed, a culture is performed if the test is positive for bacteria. So if you had a urinalysis and there was no bacteria found, then you wouldn't perform any more tests. But if you had a urinalysis performed and you have bacteria present, they're going to want to know what kind of bacteria. So they're going to need further testing, but they don't necessarily have to get an order from the doctor to do further testing. They already know the doctor needs to know what kind of bacteria, so they're just going to continue on with that testing. The only CPT modifiers used in this section are 90 and 91. So looking at the front of our CPT manual, 90 says reference outside laboratory, and 91, repeat clinical diagnostic laboratory test. So those are the only two modifiers that we're going to use in this section. The CPT manual lists drugs most commonly tested for, although the use of codes is not limited to the drugs that are listed. The modifier 51 is not used with pathology or laboratory codes. Instead, each test is listed separately. So organ or disease-oriented panels 80047 through 80081. So I'll give you a moment to get there in your CPTs. Codes in this subsection are grouped according to the usual laboratory work ordered by the physician for the diagnosis of or screening for various diseases or conditions. Groups of tests may be performed together depending on the situation or the disease. For example, there's a basic metabolic panel, a general health panel, and electrolyte panel. So let's talk about the rules of these panels. All tests must have been conducted and be medically necessary. Can't use a modifier 52. Additional tests over those in the panel are reported separately. If all tests are in the panel are not performed, you're going to list each test separately. Do not use the panel code. Okay, so I'm going to go back. Let's look at 80047, basic metabolic panel. Say that you had the calcium tested, the carbon dioxide tested, you had everything except for sodium. You couldn't use the 80047. You would have to list every single one of these separately. If you look at 80047 and you look at calcium ionized, it gives you the CPT code. Again, you would use every single one of these codes except for the sodium code because we didn't test sodium. Now say that you did all of these in 88047. You did the basic metabolic panel. And then you did urea, nitrogen, or bun. If you look at 80048, well, I guess, hang on, I'm looking, I'm kind of throwing this together as we're going. If you did the urea nitrogen, then you would use your 80048. So what I'm trying to say is every single one, well, no, 88447 has a bun in it too. One would have to look at that a little bit closer. Okay, here's the difference. 80047 is calcium ionized, 80048 is calcium total. What I'm trying to say is that if you had all of these in your basic metabolic panel, if you had all of those, but then you had some random one out there that didn't go along with the metabolic panel, you could code the metabolic panel, and then you would code that random code and add it onto that. It would be a second CPT code. I hope that that makes sense. Okay, let's talk about presumptive drug class screening, 80305 through 80307. So let's go ahead and turn in our CPTs there. You see there are going to be some rules and regulations there that you can read over. Drug screening is an analysis which identifies the presence or absence of a drug. Code this carefully. Understand that you can code the number of procedures performed, not the number of drugs being tested. It's divided by methods, and there are 3 different methods: optical observation, instrument assisted, instrument chemical analyzers, and those are your 3 codes to choose from. Identifies the presence or the absence of a drug. So let's talk about therapeutic drug assays. Drug assays test to detect a specific drug and to quantify the amount of that drug that is present. Quantitative information determines the presence of a drug and the exact amount present. Drugs in the CPT are listed by generic names. They're not listed by their official names. It's generic names. Evocation, suppression testing. This testing is performed to measure the effects of stimulating or evocative or suppressing agents on chemical constituents. So let's make sure that we have our place in our CPT that's there, 80400. Okay. Do you know which codes are used to report supplies and are drugs used in testing? Which code is used if the physician administers the agent? Which code is used if the test involved prolonged attendance by the physician? Well, I'm going to give you the answers to those. Okay, so which codes are used to report supplies and are drugs used in testing? 99070. If the physician administers the agent, referred to code range 90760, 90761, or 90772 through 90775. And which code is used if the test involved prolonged attendance by the physician? You would use the appropriate E&M code. Consultations. Oops, sorry. A consultation is at the request of a physician. And I'm sorry, guys, let's look at our code range. 80500 and 8052 or 80502. We only have 2 codes there. Okay, consultations are at the request of the physician. They may need additional information about the specimen, and the consult prepares a written report that will go back to your primary care physician. So levels, limited is without review of the medical record, and comprehensive is with review of the medical record. At the request of a primary care physician, a clinical pathologist may be requested to perform a consultation to offer additional medical interpretation. Consultations may be limited or comprehensive. Consultation codes are also found in the surgical pathology subsection. It's used when the pathologist either reviews slides, materials, or reports, provides a consultation during surgery, reported on a specimen block section or cytologic exam. So let's talk about some pathology terminology. So specimen is a sample of tissue of the suspected area A block is a frozen piece of a specimen, and a section is a slice of that frozen block. So, for example, a pathologist consults during a surgical procedure, examines one block, 88331. So I'm just going to turn to 88331 just because I want to see what that says. You guys going to turn with me? 88331. First tissue block with frozen sections, single specimen. Examine each additional section of the same block, 88332. And that is an add-on code, and you guys know about add-on codes. Urinalysis. Test on urine, and the methods of the test can be tablet, reagent, or dipstick. A reason can be pregnancy. Constituents being tested for bilirubin are glucose. What are 6 things for the coder to remember when he or she is coding urinalysis and chemistry subsections? The identification of specific tests, whether the test is automated or non-automated, the number of tests performed, the identification of combination codes for similar types of tests, or whether the results are qualitative or quantitative, and the method of testing used. Urinalysis 81000 through 81099. So let's go back in our CPTs to that so we can kind of follow along. All right, I have mine. The equipment used is either automated or non-automated, with or without a microscope. And the number of tests that are performed is important. Urinalysis codes are for non-specific tests done on urine. So what is the difference between automated and non-automated tests? Automated is done by a machine, whereas non-automated is done manually. So let's talk about chemistry. 82009 through 84999. And yes, I'm spending time going there because I like to follow along in my CPT. So specific tests on the bodily substances, urine, blood, breath, and feces. Most chemistry tests are quantitative, which is specific amount unless specified qualitative. Chemistry tests are performed on any bodily substance. Codes are in alphabetical order in the CPT book. So if you take a look at that, you're going to be able to see these tests are indeed in alphabetical order. Chemistry. Samples from different sources reported separately, for example, blood and feces. Samples taken at different times of the day are reported separately. Okay, so let's ask the questions. Would a blood test and a feces test be reported separately? Yes, because they are different specimens. Second question. If blood was drawn to check a potassium level at 8 a.m. and again at 2 p.m., would both tests be billable? Yes, they would be, because even though it is the same test performed twice, they were performed at different times of the day. Molecular pathology, 81105 through 81408 and 81479. So these are where our tier procedures come in. Tier 1 procedures that report molecular assay is 81105 through 81383. More common gene-specific procedures, for example, breast cancer gene, 81162 is BRCA1 and BRCA2. Then Tier 2 procedures to report less commonly performed analysis, 81400 through 81408. 81479 reports unlisted molecular pathology procedures. Genes are described using the Human Genome Organization, or HUGO, names and definitions. Analysis of nucleic acid to detect variants in genes that may indicate disorders or neoplasia, when a physician interpretation is required. Modifier 26 is amended to the specific molecular pathology code. 26 is our professional component. Remember, we talked about that in radiology. Hematology and coagulation. Laboratory procedures on blood. For example, complete blood count is a CBC, white blood cell count is a WBC. Codes are divided based on the method, blood draw, test being conducted. The method used to perform the test is often what determines the code assignment. So we need to remember what is the method. Immunology 86000 through 86804. Immunology codes report tests that identify immune system condition caused by antibodies and antigens. For example, hepatitis C antibody screening. Then we have tissue typing. 86805 through 86849 is a basic assay, screening, and typing. Immunology codes report tests that identify immune system conditions caused by antibodies and antigens. So I read that twice for you. Tissue typing, compatibility tests on tissue, match donor to a recipient, and it monitors cytotoxic reactions. So next we're going to talk about transfusion medication. 86850 through 869999. The subsection deals with tests performed on blood or blood products. These tests include screening for antibodies, Combs testing, autologous blood collection and processing, blood typing, compatibility testing, and preparation of and treatment performed on blood and blood products. And that is what I just read. Let's talk about microbiology. 87003 through 87999. It's a study of microorganisms, identification of organism, sensitivities of organism to antibiotics. So microbiology deals with the study of microorganisms and includes the following: bacteriology, mycology, parasitology, and virology. So what is bacteriology? That's the study of bacteria. Mycology is the study of fungi. Parasitology is the study of parasites. And virology is the study of viruses. So microbiology caution. Culture codes need to be read carefully because some codes are used only to detect the presence of the organism, and others show additional sensitivity testing to determine which antibiotic would be best to use for treatment. Many code descriptions are similar to those in immunology, and the difference is the technique used. I just read that to you. Anatomic pathology. This is post-mortem exams, 88000 through 88099. So this deals with examinations of the body after death. Autopsy codes are divided by gross exam only, or gross and microscopic. These are further divided on what the autopsy consisted of. For example, an autopsy with gross and microscopic exam with brain and spinal cord is 88027. Cytopathology deals with laboratory work performed to determine whether any cellular changes have occurred. Most common code is your pap smear. Codes are divided based on type of procedure and the technique used. Cytogenetic studies. Cytogenetic studies include tests that are performed for genetic and chromosomal studies. It's the branch of genetics concerned with cellular abnormalities and pathology conditions, for example, chromosomes. Surgical pathology, 88300 through 88399. These codes are concerned with the evaluation of specimens to determine the pathology of disease process. Pathology testing is performed only on all tissue removed from the body. The codes 88300 through 88399 include assessing them, examination of the specimen, and reporting of the findings. The unit of service for these codes is the specimen. More on surgical pathology. The diagnosis for the operative procedure is taken from the pathology report if pathology is performed. If a patient had a chronic cough and the operative report was billed as a chronic cough, but later the pathology report comes back as pneumococcal pneumonia, the cough was just a symptom of the pneumonia, which is why you should always wait for the pathology report. So more on surgical pathology. If two specimens from the same area are received and examined, each specimen is coded. The number of specimen equals the number of units. So let's talk about types of pathology examination. Microscopic examination cannot be seen with the naked eye. Gross examination is large enough to see without a microscope. So microscopic is with the microscope, gross is without. So let's talk about the 6 levels of surgical pathology. So level 1, the specimen can be diagnosed without the microscopic examination. Level 2, gross and microscopic examinations performed. Levels 3, 4, 5, and 6 include gross and microscopic examination and additional physician work, which is increasing in difficulty. It's based upon the method or the need for removal. Same anatomical site can be listed in each level. In assigning the correct code, the coder must identify the source of the specimen and the reason for the surgical procedure. The higher the level of surgical pathology, the more complex the examination. Surgical pathology is divided by the area of the body and the complexity of the procedure. Knowing these different levels makes coding for surgical pathology easier. Always look under the code in the CPT manual to find if the specimen and surgical procedure fall there. So not included in codes 88300 through 88309. Additional service codes 88311 through 88399 are not included in codes 88300 through 88309. For example, special stains 88312. Additional services are reported separately. So that was a mouthful, wasn't it? But we got it done in in one sitting. So Path and Lab, I know it kind of sounds a little bit daunting, but it's actually very fun. I like it a lot, and I hope that you guys enjoy it as well. If you have any questions, please let me know. Remember that these slides that I just did, they're in PowerPoint format, can be found in your folders. You guys let me know if there's anything else you need. Bye-bye.